Hello everybody, my name is Mark Sanis. I'm with Sanis Insurance. We're here today to talk about Medicare and help get you educated about what it's all about. It is very confusing and there's a lot of rules and regulations, and we're going to find a great way to get you through that maze and help you understand what it's all about. So let's get started. We're going to show you a roadmap in 4 easy steps. So step 1, we do want to educate you and teach you how to understand how Medicare works and what it costs. There are different parts of Medicare: original Medicare, a Medicare Advantage, supplements, which are called Medigap plans, and prescription drug plans. Step 2, we're going to kind of compare Medigap, which are the supplements, versus Medicare Advantage plans. You'll be choosing one or the other. You can't have both at the same time. Step 3, there are additional Medicare products that you can purchase that will help fill in the gaps. There are cancer policies, dental, vision, hearing, hospital indemnity, etc., that take care of some of those gaps that you have deductibles and things for. And then step 4, enrollment periods. We're going to talk about when and how to sign up. We'll also get into Medicare myths and finally into next steps, what you need to do and when you need to do them. So let's get going. Who are we? I am Mark Sanis. My wife is Sandy. We met at Safeco Insurance many years ago, and we're married with a couple of kids that are now out on their own. We've been doing the Medicare business now for about 8 years. We're into our 9th year, and we love it. We love helping people. We have a lot of experience in the insurance industry besides Medicare as well. When we started this 9 years ago, we were just in Washington State, northern Idaho. We now have expanded to 12 states. As our customers move to different states, we get reciprocal license there and help them. We are independent agents, so we're not captive. We're not just with one carrier and can only look at their plans for you. We are appointed with 30 different plus carriers and plans, and our whole goal is retention, and that means we want to educate you and help you determine what is the best plan for yourself. We do annual reviews right before annual enrollment every year. We have a wide variety of insurance products. We have year-round service availability, and in case you haven't heard, our services are always free year-round. We get paid by the carrier, but we want to be available to you with any questions you have. We are also very easy to schedule appointments, whether it be a phone call, a Zoom, or an office visit. So we will be here for you. All right, let's go to step 1. Let's learn how Medicare works and what it costs. So here are your different parts of Medicare: Part A, B, C, D, and then supplements. They don't give supplements a letter, they should. Originally, you're going to start with original Medicare, Part A and B. Hospital and medical coverage, and you need to get that first before you can choose a Medicare Advantage Part C plan or a supplement with Part D prescription drug plan. You can get one or the other of those. But let's start with Part A and Part B. So original Medicare, you need to get this first. What is original Medicare? Well, Part A is the hospital coverage. It basically is just like it sounds. It's inpatient care in hospitals, skilled nursing, hospice, home health care, and these are all for medically necessary events. Part B is medical. Think of this as outpatient coverage for doctors and providers. Think of Part A as inpatient for hospitals and in buildings. So Part B is for doctors and other providers, outpatient care, home health, durable medical equipment, and a lot of those preventive services like cancer screenings, flu shots, mammograms, vaccines, and even colonoscopies. So are there costs associated with these parts? Oh yes. So if you were just on Parts A and B, not on anything else coverage-wise, you'd have a deductible of $1,630 for Part A, and it's per event. So if you went in and had a shoulder surgery one part of the year and a knee surgery the second part of the year, you'd have 2 of those deductibles. If you stayed past 60 days, 61 to 90 days, you'd pay an additional $416 a day. And if you stayed past 90 days, you'd pay an additional $816 a day. So while it's coverage, it's not the best financially. There is a premium to Part A, and usually it's in the $600 to $700 a month range. However, if you have worked during your working life and paid taxes for 40 quarters, which is 10 years, they're going to subsidize the premium down to 100%, which is great. Now, Part B has a deductible as well. It's $240 this year. It does go up incrementally a little bit each year. It's a one-time annual charge. They also will pay 80% of those doctor bills and everything else that falls under Part B, which means we have to pay 20%. If you're on a $100,000 surgery and 50% of it's doctors, and you have to pay 20% of that $50,000, that's a $10,000 bill. Very expensive. But again, it's coverage, but it's not the best financially. There is a premium as well, and it is in the $600 to $700 range per month. They're not going to subsidize it 100%, but generally about 75% they'll subsidize it. So it is based on your income. They do a 2-year look back. So if it's 2024 right now, they'll look back at your income for 2022, and they get that from the government and the Social Security site. So they will know how much you're making income-wise. If you make $103,000 or less for a single person, or $206,000 for a joint income tax, basically you'll pay $174.70 as your monthly amount for your Part B. Now, if you make more than that, it incrementally can go up, and there are charts to show how much you will make, and you can give us a call. We'll be glad to show you those. When you do get your Part A and your Part B, you'll get this red, white, and blue card. You'll have your name on it, you'll have an ID identifier, and you'll have your effective dates for Part A and B. Once you have that, then you are eligible to get Part C or a supplement in Part D. Let's talk about Part C. These are Medicare Advantage plans. They are very similar to employer plans, like you're probably familiar with if you were working and on one of those. They are offered by private insurance companies. You've heard all the big names: Humana, United Healthcare, Providence, Aetna, etc., etc. These are plans that have to be and offer as good a coverage as original Medicare and better, and they do, because they offer a lot of extra benefits too. Medicare does not endorse or recommend the plan. They simply approve them to be sold. And Medicare Advantage plans come in 2 flavors. They come with the medical and the drug plan together. Those are Medicare Advantage with prescription drug plans, MAPDs. Or they can come with just the medical part, just Medicare Advantage only. And those are great for vets because they get their drugs from the VA for no charge usually. So they only need the medical. Now, there are different types of Medicare Advantage plans. There's health maintenance organizations, PPOs, preferred provider organizations, and then the combination of the 2, as well as special needs plans. The health maintenance organization means that they have contracted doctors, and they have set prices on everything you do health-wise. So you're getting a really nice low charge for the services. Now, there are times where maybe you want to go out and see a specialist. And in the past, you couldn't do that because you had to go to their contracted doctors. However, now with the PPO type plan, you get the best of both worlds. You can go into the health maintenance organization contracted group and use them, or you can go outside of a non-contracted doctor and you will pay a little more, but at least you've got that coverage. For special needs, there are a lot of people on Medicaid and Medicare, and so these special needs plans are dual special needs, and they can help for that situation. There's also chronic special needs and institutional special needs plans that we can help with. To be eligible, you must reside in the service area, and you do have to be awarded and pay for Part A and B. Medicare Advantage plans, a lot of people don't realize this, but you've been paying taxes your whole life, working life on this. And if you pick a Medicare Advantage plan, that company, that carrier, is going to get approximately $10,000 a year on your behalf. And they do this by doing those wellness checks once a year. And they submit those to CMS to be paid that. And that's how they can keep the premiums on Medicare Advantage plan all the way down to zero on most of the plans. So no premium on those plans. And they can increase the benefits and have really good benefits like dental, vision, hearing, etc. So they may interview every single one of their client base, and the average is 10,000. Maybe they interview me and I might just have all kinds of issues, health issues, so they might get 15,000 from me. So that's why they require these wellness checks, and it's just basically a bunch of questions to see how you are every year, and then they can get more money from CMS, the Center for Medicaid and Medicare Services. Medicare Advantage plans, super low premiums. We mentioned zero on most of the plans. They do have deductibles, co-pays, and co-insurance for everything they do. They do also have a maximum out of pocket, so you can only go up to a certain limit, and then they'll pay everything else after that for the rest of the year. It is a pay-as-you-go type plan, so it's a $0 premium, so if you're not using it, you're not incurring any of those deductibles, co-pays, and co-insurance, unlike being on a supplement. And of course it includes those extra benefits. So what are some of those extra benefits? Well, you do get dental, you do get vision, and you do get hearing and hearing aids. Also fitness programs, over-the-counter benefits. You get a small stipend every quarter to buy vitamins and other things. And they can include, these plans can include other things, chiropractic, acupuncture, naturopath, etc. So it really depends on the plan and what your needs are. And that's where we come in, is where we analyze all this for you and help you find the right plan. Your other option now, if you have A and B, original Medicare, is to get a supplement and a Part D prescription plan if you want to. So what do supplements do? They follow original Medicare coverage to a T. They don't add anything extra like Part C does. So they will follow the coverage exactly. It is the same exact coverage. It's not any better or worse, it's the same. So you do not get dental, vision, or hearing, and you need to get those in other places, and we can help you with that. And then supplements are really basically medical, so you do need to get a Part D prescription standalone plan if you require that. So let's talk about that a little bit and what those plans look like. So there are quite a few actually supplement plans, and remember these are medical. They label them A through N, and these are plans, not parts of Medicare. And supplements are also called Medigap plans, so you'll hear that terminology. The most popular ones are the F, the G, and the N. If you're just turning 65, you're not eligible for the F anymore. You had to be 65 by January 1st of 2020. But look at the G and the N. The G plan, you'll see a lot of 100% there in every category, which is fantastic. There's only one that's missing, and it's the Part B deductible. That's that $240 amount you would have to pay the first time you incur a bill during the calendar year. The cost of the G plan is basically the lowest end from the carriers is about $235 a month. And so that's times 12. On the N plan, it's $150 a month. It sounds better, but there are co-pays as you go into some of the areas here. So you'd have to pay approximately $20 to see a doctor under this plan, $50 for emergency room, and yes, you need to pay $240 for that Part B deductible. And the other caveat is it doesn't pay for excess charges. And there are some entities, providers, that can charge up to 15% over the bill, and you would have to pay for them, and they're not covered here under this plan. They are covered under the G, and they're covered under Medicare Advantage as well. So they're very good plans. They're a little more expensive than Medicare Advantage, but they do cover all medically necessary items. So supplements or Medigap plans, they're all standardized. So a G plan is a G plan. It's the same coverage no matter which carrier offers it. And you're going to see different prices by different carriers for the G plan and for the N plan. And why is that? Basically because that company either wants more business or doesn't want business in your specific area. So they change their rates quite a bit. Generally, April, May, you'll see an increase every year on supplements. Okay. There are no networks and there are no referrals when you use a supplement. You can see any doctor that takes Medicare assignment in the United States, and that's approximately 95% of all doctors. So that is a good thing. There is a special supplement open enrollment. It's different than Medicare Advantage. When you sign up for Part B the first time, your effective date, you have 6 months to sign up for a supplement and you'll be guaranteed issue. They will not look at anything in your previous history. If you sign up for a supplement after that 6-month period, you'll be underwritten and they're going to ask you approximately 30 health questions. If you answer all of them no, you're going to be underwritten and you'll be approved. If you answer them, even a 1 or 2 of them yes, they can deny you and you will not get a supplement. So you have to kind of decide, do you want a supplement early on, or if you're healthy and later on you want it, you can sign up, you can get it. Or if you are on a Medicare Advantage plan for several years and now you want to move to a supplement because it covers things a little bit better, you could be denied. They do have time limits on certain things too. So maybe you had an issue where you would be denied initially, but then after several years, you may be eligible again. So we can look at all of that for you. Part G, or Plan G, excuse me, we kind of talked about a lot of great things that it covers 100%. It even gives you foreign travel up to $50,000 at 80%. You would owe the $240 Part B deductible, but the cost of this is only $235, so it's fantastic. Plan N, we kind of talked about the $20 doctor visits, the $50 co-pays for emergency room, and the excess fees, and the Part D deductible that you would owe. Still a good plan. A lot of clients I do have on this plan, and I would highly suggest that you get a life flight plan if you're getting an N plan. The reason being is that excess charges apply to transportation. And if you had to be life flighted in, it ranges anywhere from $10,000 to $20,000 just to fly into the hospitals here in Spokane. So if you are on a life flight plan, it's $75 a year, and it's for everybody that's on your taxes. So it could be well worth it if you needed to have that. The chances are you're probably never going to need it, but I got to tell you, I have a lot of examples of clients. One guy was up north of Spokane, and it was a $40,000 charge, and luckily it saved his life, and he did have life flights. So, all right, supplements in Washington State. There is a little thing called portability. We had an insurance commissioner by the name of Deborah Sin in the early 80s who got it passed that if you're on a supplement, you can switch to any other supplement, up or down, A through N, monthly, and you can get guaranteed issue. So if you're on a Medicare Advantage going to a supplement, you're going to be underwritten most likely. But if you're on a supplement moving to another supplement, you can do it monthly, guaranteed issue. That's fantastic. A lot of states you don't have that. Oregon, Idaho, and California now have what's called the birthday rule, where right around your birthday you have 30 to 60 days, depending on which state you're in, to change and move to another carrier that might have a better rate on that same exact plan. All right, let's talk about prescription drugs. These are amazingly expensive. We all know the pharmaceutical companies place some very high retails on some of the medications. These plans are offered by various insurance companies. We all have heard of them as well. And they can be a standalone drug plan, or they can be included with a Medicare Advantage plan. In most cases, you cannot add a separate standalone prescription plan to a Medicare Advantage only plan. You need to purchase that Medicare Advantage with a prescription drug plan. Otherwise, you're going to knock out your Medicare Advantage plan, the medical part of it, and you'll be left with just the drug plan for the year, and you do not want that. So again, get with your agent to walk you through these options so you don't get caught up in any of these issues. Common tiers. So most of the plans have a formulary that has 5 tiers. Tiers 1 and 2 on your drugs are the preferred or non-preferred generics. These are the very inexpensive medications. If you're on a tier 3 or 4 medication, these are the brands, preferred, non-preferred. And then tier 5 is specialty, very, very expensive meds. Some terminology you need to know. Quantity limits. As you all know, you can only get a certain amount of pills to be given to a member at one time. There's a thing called step therapy, and if you hear that, it pretty much means that you're going to start with generics, and then they're going to move you up to the more expensive and more powerful medications. Prior authorization, you need your doctor to approve certain medications as well as the plan too. And then there's transition fill, and this is a good thing. If you're moving from one plan to another, you get 90 days for transition for the prior plan to make sure you have your medications. There's a thing called low income subsidy. If you know of someone or you yourself are making $20,000 in income or less, you might qualify for low income subsidy. And it's just a form you have to fill out. They don't want you to have any financial assets, but they don't count the home and those type of things. But if you have a financial asset like a 401k or something, you might not qualify. But if you're on this program and you do qualify, they're going to reduce your Part B premium, they're going to reduce your Part D premium, if any, and they're going to reduce all your co-payments for your medications. So it basically eliminates that coverage gap and donut hole, and this is great. And once you qualify for this, no matter what plan you go to with Medicare, it's the same issue. Low income subsidy will apply. So it's really kind of a great benefit for that situation. All right, for the drug plans, this is going to be fun to explain. This is new. There are prescription drug plan phases, and there always have been, but there's a new bill that came out. It's called the Inflation Reduction Act, and I'll talk about that right after this. But for the regular phases that we've always had, whether it's a standalone drug plan or if it's included with Medicare Advantage, there's a deductible, initial coverage, coverage gap, the donut hole, and catastrophic coverage phase. So you start out the year on your drug plan, and if you have a tier 3, 4, or 5 medication, you're going to be subject to a deductible all the way up to $590 annually, just because you have one of those higher tier medications. If you're just on tiers 1 or 2, you're most likely not subject to the deductible and you won't have to pay it. Once you get past that deductible phase at some point in the year, most likely January, you move into what's called the initial coverage phase, and you're going to be paying about 25% for your brand, your tier 3 and 4 medications. And that's 25% of the retail amount, and we all know how high those can be. So once you move on and you add up the totals that you have for the various months, between the plan and what the member's paying, if it hits $5,030 for 2024, you now will move into what's called the coverage gap phase, or the donut hole. And it's very easy to get to that $5,000 when some of your medications maybe have a retail amount of, $2,000 a month. It doesn't take very long. So now you move into the coverage gap, or the donut hole. Now you have to not only pay 25% of your brand medications in tiers 3 and 4, you also have to pay 25% of your generics tier 1 medications. So you're paying even more. And then there's this true out-of-pocket amount. And if you hit $8,000 during the year at some point, in 2024. Then you'll move into the catastrophic coverage area. And once you hit that, then a member doesn't pay anything for their medications, and they've actually eliminated a 5% co-insurance clause that was there in previous years. So you can see deductible, initial coverage, you move into the donut hole, you might hit the coverage gap by the end of the year, and then you have to start all over in January and do this all again. So it can be extremely expensive, and this has hurt a lot of people, these phases. So what is happening to this for 2023, 24, 25, and on? They signed a bill called the Inflation Reduction Act, and part of this Reduction Act pertains directly with Part D Medicare, the prescription drug plans. So they signed it in 2022. It became effective in 2023, last year. And in 2023, the vaccine coverage expanded and there were no costs. So if you were ever needing a shingles shot, which is Shingrich, it used to cost $200 a shot, and there were 2 shots. Well, if you're on Medicare right now, it's $0 cost, so check into that. Insulin savings program was developed. There used to be co-pays of upwards of $500 a month for insulins. They've reduced those and capped them at $35 for a month's supply now. That's great. This year, in 2024, they eliminated that 5% co-insurance clause from the catastrophic area. That helped a little. But the big issue is next year. In 2025, they're going to put a limit on what people will pay for out-of-pocket for drugs. So your maximum out-of-pocket for prescription drugs has been reduced from $8,000 down to $2,000. That's the most you will pay for all of your drugs next year. Now, this eliminates the coverage gap and the donut hole, which is a great thing. And if you can show that you do have medications that will hit the $2,000 mark, you can apply for what's called the Medicare Prescription Payment Plan, where basically it just evens out what your costs will be. So it'll be approximately $167 a month times 12 months, puts you right at the $2,000 amount. Now, this doesn't reduce your cost of your drugs, but it does spread out the payments to make it more manageable for you. And you do have to apply for that yourself through the carrier that you're with on your prescription plans. It's not automatic. So remember that. In the years 2026, 27, 28, and 29, for the very first time, Medicare gets to negotiate prices with the pharmaceutical companies. The pharmaceutical companies have had carte blanche on putting whatever price they wanted on all of these plans. And I'm going to give you the example of the EpiPen, where they were charging over $600 quite a few years ago for 2 EpiPens that cost $10 to make. I'm sorry, it's price gouging if you ask me. They say it's research and development. I'm sorry, I disagree. That's my opinion. So Medicare finally gets to negotiate, and this is the very beginning of it, in the next few years on some high-cost prescriptions, and it's going to be about 10 to 20 of those each year. So we'll see how that all works out, but it's a start, folks. All right, let's take a look at who pays during this Inflation Reduction Act bill. So in the past, in 2023, you can kind of see the 4 phases up here: the deductible, the initial coverage, the coverage gap, and the catastrophic phase for 2023. The dark blue is the enrollees. That's you and I, and we would have to pay 100% of the deductible, 25% in the initial coverage phase, 25% in the coverage gap, and even in the catastrophic area we'd have to pay. Now also in the purple, that's where the Part D plans, the carriers, would be paying. The blue are the drug manufacturers, and the green is Medicare itself. So you can see who pays what for the different phases. In 2024, it's about the same, 4 phases, 100%, 25, 25, but notice the catastrophic phase, the enrollees don't pay anything, and your meds are paid for by other entities. And then look at 2025, there is no coverage gap, donut hole area. So there's only 3 phases. Yes, we have to pay 100% of that deductible, And then we'll be paying 25% of the retail amount until we hit $2,000 during the year. And then other entities will take over from there. So that is the big change that's going to happen. Now, is this good or is this bad? Well, it's a little bit of both. So let's just go through here. What's positive and what's negative? We've already talked about what's positive. The vaccines are going down to 0 and expanded. The insulins are capped at $35. They eliminated the 5% coinsurance clause from CAT coverage. There's a maximum out of pocket that's going to $2,000 for the most we'll pay for co-payments next year. Elimination of the coverage gap, the Medicare prescription payment plans being initiated, and Medicare for the first time gets to negotiate on prescription costs for the several years going forward. So that's all fine and dandy, that's great. But what's negative about it? All right, so think. If pharmaceutical companies, which make a lot of profit, are now being reduced in their profit, what are they going to do? They're going to increase premiums on their drug plan, and they're going to change their formularies so that the percentage of costs goes up. How does that affect everything? Well, there's going to be major changes for this upcoming annual enrollment period for the plans starting in January of next year. And I'm talking major. I've been around 8 years, going into 9, and this is probably the most disruptive one I've ever seen. We, as agents, cannot talk about things until October 1st, and then we can relay what we know and share the details of the plans as well. On October 15th is when we can officially sign you up for plans for next year, and that goes all the way through December 7th. So you have about a 7-week window there where we can actually help move you. I usually help about 10% of my client base switch to different plans for various reasons every fall. However, this year they're saying that it could be upwards of 70% just because of all the turmoil and shakeup. So let's talk about that. There will be a lot of carriers, and when I say a lot, I can't tell you exactly. I do know, but I can't share some of that yet. But each state may have carriers that are leaving the market and not selling Medicare Advantage plans anymore. If you're on one of those plans, guess what? You need to switch or you will not have a plan next year. You'll be back on original Medicare. Medicare Advantage plans, they will have decreased benefits. They're not receiving as much money next year from the Center for Medicare and Medicaid Services. Hence, they're going to decrease their benefits. They're going to increase their prescription copays, and etc. So I do think Medicare Advantage plans next year are going to stay with a low premium down to 0, but I can tell you they are going to increase prescription costs for sure and decrease other benefits and maybe even eliminate them. So we'll find out October 1st. Now the standalone prescription drug plans that go with supplements, they definitely are going to increase in premiums, and they're going to have increased copays as well in their formularies. There are a few of the carriers that are in the drug realm, the prescription drug realm, that have super low premiums right now, and those are going to drastically change for next year. The $2,000 cap that you would pay for your medications at the most for next year does not include the premiums. If perchance you get on a plan now that has a $40, for example, premium, that's $480 a year times 40 times 12. That's in addition to that $2,000. Also, that $2,000 cap doesn't include the prescription deductibles. If you have a tier 3, 4, or 5 medication, you're going to be paying upwards of $590, and guess what? That's on top of the $2,000 too. So a lot of clients out there are going to be what I call shopping, and they should. They should have their plans reviewed by their agent, and if they don't have an agent or they haven't spoken to one in years or they did this all on their own, give us a call. We will guide you through, and we do not charge anything for this. We have the capacity to help not only our clients but new folks too, and we are willing to help you, so give us a call. All right, so here's the bottom line. You're going to see a big variation in premiums, co-payments, and covered drugs for the annual enrollment period this year. You're now just starting to receive your annual notice of change documents from the carrier that you're with right now. These always come in late September, which is now. So read those. You're going to find that there's going to be less benefits. There might be a reduction in benefits. They might eliminate benefits on your plans. Premiums may change, especially for prescription plans, and formularies will also change. So again, get with an independent agent to make sure that you can review all of that and figure out what's best for you, and should you switch. And also, if your plan is leaving the market, you definitely want to then change. A lot of carriers have maybe 6, 7 different plans, and they're going to condense those down to just maybe 3. So again, you might be dropped from a plan and not move to one that you really don't want or isn't the best for you. So it really would behoove you to get with the independent agents and have your plan reviewed. I was very proactive, and all of my clients have already received about 3 weeks ago, maybe 4 weeks now, a letter. It's our annual letter, and it included this link to Retire Flow, which basically they can just go in there electronically, sign them, and put in their doctors and providers that they want to use, and then all their medications, the name, the milligrams, and how many they take a day. And with that information then we can, on October 1st, start going in and finding out with our software which carriers financially and benefit-wise would be best for them. And if some have left the market, they'll be not showing, and when we can move them to a better plan. So we sent this out 3 or 4 weeks ago. We've got a ton of them coming back from our clients. And we're going to analyze those the first few weeks of October, and then we're going to sit down with people October 15th and go forward. And again, this is no charge for our service. We get paid by the carriers. All right, let's just take it to overall costs. So if you were new to Medicare or just signing up, your Part A most likely is 0 because you've been paying taxes for 40 quarters. Your Part B, probably $174.70 a month to get that. Now you have A and B, and once you have that, you can get a Medicare Advantage plan with a drug plan included, and the cost of the premium is all the way down to 0 on most plans. There are some that's way up there, but I would look at these. There's some fantastic plans out there with extra benefits for you. Or you can choose a supplement with the standardized Part D prescription plan. Now the G supplement is about $235 a month. The N is $150, and this is per month. And then your Part D, these are probably going up to 30, 40, maybe $50 a month. When you add these two together and multiply it by 12 months, you're hitting approximately $3,000 out of your pocket just for the premium on these plans. And that doesn't take into consideration the co-pays on the Part D drugs and or anything else you would have to pay for a supplement plan, like the Part B deductible, etc. So you're paying up front $3,000, and you haven't even incurred or used anything yet. If you're fairly healthy, maybe you should consider a Medicare Advantage plan. And we're going to help you analyze that, because there are definitely reasons to be on a supplement and definitely reasons to be on a Medicare Advantage plan. And we will walk you through those benefits and figure out which one really is the best one for you. We look at your lifestyle, we look at your financial situation, and then you help us with your health care needs, and we'll figure out which plan is best for you. There are late enrollment penalties. I won't get into this too much. We help keep you away from these penalties. If you didn't sign up when you were supposed to, you can be penalized for Part B, and you can be penalized for Part D, and you just don't want that to happen. So we'll watch out for these situations for you. Let's compare a Medicare Advantage plan with a supplement and a prescription plan. Real basically, Medicare Advantage, we kind of just hit on this. You're paying $3,000 for a supplement and a prescription plan versus $0 for a Medicare Advantage plan, and it's a pay-as-you-go. You have super low premiums, as we talked about. You have a maximum out-of-pocket on the Medicare Advantage plan. They are HMO and PPO option plans. You may need referrals for specialists, but really it's not the insurance company that needs it. It's the specialist wanting it from the primary care doctor to make sure that they're being referred for the right reasons. You do get extra benefits on the Medicare Advantage plans. You get dental, vision, hearing, fitness, and other areas. You also get emergency and urgent care throughout the United States and in some cases the world, that you have coverage wherever you go. Medicare Advantage comes in the two flavors, with drug plan and the medical, or just medical only, which is great for veterans. And some of these plans have give back. Supplements, on the other hand, high premiums but minimal copays, covers most of the A and B costs, including that 20% for Part B and the hospital deductible. It's a freedom to choose your doctors. 95% of all doctors take Medicare assignments, so supplements are well looked at. No referrals technically are necessary. It doesn't cover dental, vision, or hearing. You'll have to get those elsewhere, and we can help you. Again, you're covered most everywhere in the United States. You do need to buy a drug plan separately, though. So a little more costly on this end, but coverage is good. All right, how do you choose which way to go? We just kind of talked about that. We're going to help you analyze your health, your finances, and your lifestyle, and we'll look at your needs, what you really need and what's best for you, and then we'll make a determination. All right, there are other products that fill the gaps, as we call it. Oops, let me go back. Dental, vision, and hearing, if you don't get it, if you're on a supplement, we can find those for you. Cancer and hospital indemnity plans. We highly suggest you look at these as well. Cancer is a very expensive venture, and the plans don't cover everything. There's a lot of incidentals. Travel, wigs, going, hotel rooms. I mean, there's just a lot with cancer, and it's a simple plan that costs you a few bucks every month, and you get a lump sum once it's determined you do have cancer, and it can really, really help. I personally lost a sister to cancer at 52, when she was 52, and she fought it for 4 years, so I'm pretty familiar with what she went through. Hospital indemnity plans, also great. All those little deductibles and copays can be covered for a few extra dollars if you want to do that, and so it's a great option as well. Enrollment periods, when to sign up and how to sign up. All right, here's some acronyms in the insurance world, especially for Medicare. There is what's called the initial enrollment period, IEP. So when you're first turning 65 or so, you're in the initial enrollment period, and you can sign up 3 months before your birth month, and 3 months after. We highly suggest that you do it as early as possible, which is 3 months before. That way there's time for processing with Medicare to get your Part A and Part B card, and then time to actually sign up for plan, because that'll take a few weeks as well. And you want to get your cards before the 1st of your birth month, because that's usually your effective date. There is also annual enrollment period. So every year, October 15th through December 7th, you have a chance to review next year's plans, and you can change the one you're on to theirs, or you can stay with the plan you're with. And then SEPs, special enrollment periods. During the year, you might have a special enrollment period where maybe you move from one state to another, or a county or to another county. So you might have a special enrollment period. Every January and February and March, there's a Medicare Advantage open enrollment period. So say you signed up for something in the fall, October through 15th through December 7th, and then it starts on January 1st, your new plan, but in the meantime you found out, oh, I'm now on a new medication that's going to cost a lot of money, and I could be on a different plan that might save me some money. Or my doctor moved and changed, and maybe I need to, again, change my plan. Well, that January, February, March of the next year gives you a one-time option to move from a Medicare Advantage to another Medicare Advantage plan. It's just a great option for you. You also, at that time, could drop Medicare Advantage altogether and move to a supplement and a standalone drug plan if you qualify. Now remember, supplements have a different open enrollment period, and that's 6 months past the effective date of Part B. And if you sign up during that period, you're guaranteed issue. If you wait after that, you're going to be underwritten and have to answer the 30 questions. If you're healthy, no problem. If you're not, you most likely will be denied. There's also what's called general enrollment period. And if you missed all these other enrollment periods before, we can get you signed up under the general enrollment period. So definitely give us a call and we'll help you there. All right, who's eligible to enroll for Medicare? Well, generally it's for people that are age 65 and older, or if you have a special condition, or you're on disability for 24 months. If you're on disability for 24 months and you're under age 65, they'll automatically send you your red, white, and blue original Medicare card, and then we can get you signed up for a Medicare Advantage plan. This is based on your employer. So there are a lot of people that are continuing to work past 65 and they're on employer coverage. If you're with an employer that has more than 20 employees, they deem that creditable insurance, and you can defer getting Part B until you decide to retire or drop that insurance. If you're with an employee that has less than 20 employees, it's not creditable insurance, and you need to sign up when you're 65. If you don't, and you go years down the way, you'll have a penalty when you come back, and you'll have to pay that penalty for the rest of your life, so you do not want that. A lot of people think if I go on COBRA coverage, I'll be able to avoid a penalty. Not so. Medicare does not consider COBRA coverage, even though it's the same insurance you had before, but they don't deem it as creditable. So don't get caught in that situation too. And again, that's a great reason to work with an independent agent. So your IEP is the initial enrollment period. If your birth month is right here in the middle, you have 3 months before, 3 months after, and your birth month to sign up. We highly suggest that you sign up for original Medicare 3 months out, and then it takes a few weeks, sometimes 3 or 4, to get your card, and then we have to apply for whichever plan you want, and that could take 2 to 3 weeks, and then you'll get your cards right before your birth month. If you wait and delay, it can push things out, and you just don't want to get caught without insurance. Because guess what? That's when things happen. Now, can you be automatically enrolled? Yes. So if you're on Social Security and taking payments before you're 65 and turning to Medicare, they will automatically send you your Part A and Part B card 3 months before your birth month. So you've already got it. And that's at that point, we can get together and talk about what would be the best plan for you and get you signed up for the first of your birth month. Also, if you're on disability, we talked about this. You have 24 months of disability before you're 65, then we can get you signed up because they're automatically going to send you a card. If you aren't automatically signed up, you have to manually do it. I had to do this because I wanted to defer my Social Security benefits until I was 66 and a half. So I had to either go online, which you can do, or call them. There's the number. It's 1-800-MEDICARE, so 1-800-633-4227, or you can actually go into your local Social Security office and sign up there. I can tell you the phone and in-person options can take hours to get through or to get in. The online version is the easiest way to go, and you basically would go to the ssa.gov site. That is Social Security Administration.gov site, and there's where you sign up for Medicare Parts A and B. You don't have to sign up for Social Security because you don't want the payments yet, but you can sign up for Medicare Parts A and B there. If you have your password for that site, then I can help you walk in and show you how to sign up for Medicare. It takes 10 to 15 minutes, and it's very short and sweet. If you do not have that online site because you're kind of waiting to get your Social Security payments at a later date, I highly suggest you go in there anyway and get that account signed up. Not that you're going to ask for any money yet, but get that account signed up. I have had actually 2 of my own clients here in Spokane, Washington get hacked, and they waited until 66 and a half, went in to sign up, and they were summarily informed that they've been being paid since they were 62. So they had to then justify to the government who they really were, and that took a few months, and you just don't want to go through that. So if you at least get the SSA.gov site set up, even though you're not taking payments, that will help for security. So I highly suggest you do that. All right, we talked about the supplement open enrollment 6 months after getting Part B effective date. We highly suggest you do that. Otherwise, there's no guarantee that the insurance company will accept and approve you if you do have issues. Here's a quick myth for Medicare. So basically, understanding Medicare, all the different parts, the eligibility, the enrollment periods, the costs, the penalties, how to sign up, and choosing the right health and drug and plans for your specific needs is easy. It's not easy, folks. You could be going into Google and just put in Medicare, and you will not believe how much is in there. Some of it's right, some of it's not right, and it really depends on your individual situation. So I highly recommend you get with an independent, not a captive, but an independent adjuster, independent agent, and have them walk you through, and one that's been doing this for a while and has the experience. That way you're going to get a really good feel and know which plans are best for you in your area. We do it. It's no charge for us. Again, we get paid on the back end, so feel free to give us a call if you want that help. We would greatly appreciate that. That's pretty much how we grow our business, is client referrals, and we have a lot of great clients, I can tell you. So here we are again. I just want to point out at the bottom, if you want to check us out on Google and how many 5-star reviews we have, you'll see we have quite a few. And I really think the best recommendation comes from your own business's clients. So read those, check us out. You can also go to our website at sanisinsurance.com, and there's a wealth of information there as well. You can call us for an appointment or just have questions, 509-993-9887. And if you want to set up an appointment, we highly suggest you do this early because our clients are already booking appointments, and if you're new to us, we want to get you in. So we have a little site called calendly.com/sanisinsurance. You can go in there and you can pick your date, you can pick your time that's available, and then you can choose if you want to do a phone call, a Zoom, or actually come into the office. So let us know what works best for you, and we really hope we can help you out. Our services, again, are free year-round, and we just look for helping out people. We love this business. We meet so many great people, and there's so much confusion in this business. So give us a call. We do have a new office. We've been up on a street called Pines in the Valley of Spokane for 8 years, and we just moved to this new address on Mullen. It's a bigger office, and we're on one floor and not up and around the back of a building. Our previous building had quite a little road to get up in the winter and made it pretty challenging. So now we're easy to get to and on the first floor. So thanks again. I hope this was very informative for you. Give us a call, please, with any questions. We'll be glad to help you. And thanks again.